Assalamu alaikum. Okay, this is another case where students are asking for approvals. We're still in the first clinics and students are asking for approvals for cases. This is what we usually face, okay? We usually face this problem where we have a tooth tilted and these teeth are still standing, okay? And this is the space. Now I want to ask you a question. Okay, which tooth is this? I'm still with the identification of the teeth. 7. Do you say it's a 7?
Yes, I think لأنه two roots.
Two roots. Okay.
7 أنا حاسة.
It's a 7, wide crown. Okay. But is the 7 usually tilted this much?
يعني ممكن يكون 8.
Could be an 8.
هلا ممكن
And
كمان
I'm looking at something else. Look at this. This is the 7. Okay, let's take this as an occlusal width. Okay. If this was an S6 extracted, this should have been upright, صح? This you're talking about. This is the space of a 6. It is usually almost and even a bit wider. Okay, صح? Is it a bit wider from a 6? A bit wider. With the mesially drifted tooth, because if this was upright, it should have been here. So is this a space for the 6? All of this is a space for a 6? Okay, because usually when the teeth rotate, they rotate around the axis. So wherever their roots are, this is was their original position. Okay, so this might be the 8. Look at all of this space. Is this all space of a 6? No. I know. For looking at the morphology, this is a wide crown, separated cusps, separated roots. But we do have 8s with separated roots, don't we? صح, we don't have? Okay, so the idea is, once more, look at how much tilt this tooth had, and is this all the space for a 6? No. So this might be an 8 that has been mesially drifted. The amount of drift, it's severely drifted. That means it's a very early extraction. The 7 drifted and the 8 drifted with it. Because which teeth are almost going upwards?
8.
8, not the 7. The 7 are still flat on the mandible. The mandible, it's the 8 that goes into the corner where it rotates like this. So probably my evaluation that this is an 8 with a lot of rotation anteriorly. Okay, very early extraction, and then rotated anteriorly. So this will show you how much could I deal with the rotation, because I discussed it on papers once, and this is a case good for this. I have it on paper. Discussed earlier, because how much can I prepare? I need to upright this, صح? To accommodate a tooth. I'm going to upright this. I'm going to prepare an enamel. Okay, it's still not upright. I have to go to dentine. It's still not upright. I might reach the bone. So what are the options here when I do this?
Telescopic crown.
Telescopic crown. What else?
Orthodontic treatment.
Orthodontic alignment. What else?
نحضر الميزيال side بس
As a partial crown. Okay.
في ضل خيار رابع.
Partial crown if we have a sufficient bone tooth structure and we have a sufficient occlusal table. But if it was a small 8 with not sufficient occlusal table, it won't be enough. It's like an onlay preparation. What else do we have options?
Cantilever.
Cantilever.
partial لا مش
Cantilever what? Cantilever what? 6?
Yes.
In the place of the 6, which should be here. What will happen with an already mesially tilted tooth with a cantilever?
حيكون تورك كثير.
Torque? The huge torque.
اوكي دكتور ممكن نعمل كونكتور.
Non-rigid connectors. I could crown these and put a non-rigid connector here or an attachment as a stress breaker. Okay?
We might يعني replace the missed tooth with 2
Yes.
molars.
We could replace the tooth missing with 2 premolars. It doesn't have to be a 6 morphology.
Yeah, yes.
We can do it with 2 premolars, especially if it's a bit larger than this space.
Yes.
Okay, so we were talking about the severely tilted tooth and how to identify the tooth. I would say this was an 8. This was its position originally, and this was all the 7 drifted, covering the 6, and look at the spacing. Look at the roots of the 5 and 4. They are spaced.
أنا تأبيز دكتورة إنه الأوكلوزال فورسز عليهم كانت high since إنه ما في هون حتى
Yes.
يعني we can see هون.
See the roots?
Yes.
Okay, so the roots are tilted, and this is يعني usually what we see if an old extraction, this would be going like this. Okay, but because of the occlusal force, it tipped mesially once more.
Yes.
But usually when we have an early extraction, the five go distally.
empty side.
The empty side, but depends on the occlusal stop. So it shifted it here, but this was its original position. it means that it shifted from the root here, being here, okay? So now talking about something else. This tooth has an endodontic treatment. Is the opacity of the treatment is okay?
Yes.
Opacity is excellent. Is the length of it?
Yes.
Okay. What is the root end?
Is it resorbed يعني مع الوقت؟
Think here?
Yes, I think it's here.
Is it here?
هلا
You
هون
see something here, صح?
Yes,
You see something here.
كأنه كان في resorption صار healing
Or you see a tracing of the periodontal ligament. I lost it here. But if I trace this and trace this, I think this is the apex, not this one.
أنا بتوقع إنها هون.
It is, yeah. But I'm telling you, how am I going to identify it? How do we trace?
We follow the PDL.
The PDL, and the PDL went in this direction. This is what confused us. If it was this the root, it would be short, but this is the
It might be
root.
the mental foramen.
Where? The mental foramen is here. Okay.
Maybe this is radial sensitive to occlusal trauma.
Maybe you can see the widening. Occlusal trauma. There is widening. Okay, what do we do with this tooth?
I think the coronal structure is sufficient, so we have to restore it to this. Yeah, it doesn't.
What do you see here? Is it in the same color of dentine? This is composite. This is all composite. If you prepared, what will happen?
راح يكسر.
Empty. We don't have enough dentine في الcore area. صح? The endodontic axis is very wide. This is traumatized. We should not do endodontic like this. If suppose this was going to be doing endo, the axis should be only like this.
Yes.
It should not go wide.
Straight.
يعني the endodontist wants to make it easy for him, but he will ruin our opportunities to restore the tooth. So don't make large axes. If it was like this, it should be like this, a bit wider, just a bit. Okay, but not like this. Look how much dentine. If I'm going to prepare here, what will happen? It's too much flared. Okay, so post and core, preferable metal core or composite core. Fiber. I mean fiber core. Fiber post. Fiber post or metal.
I would go for fiber.
Why?
Because metal is really traumatic بالأخص إذا كان serrated قصدي على البوست itself.
Okay.
يعني هلا حتى recently كلهم عم بيفضلوا الفايبر بوست.
Fiber post. But still, there are some benefits for metal.
Yeah, it's more.
You can raise the margin, صح? If it was a deep margin, you can do the crown, the bridge on. But all of these options are talking about compromised cases, meaning guarded prognosis. We're going back to guarded prognosis. Having an abutment that had an endodontic treatment as an abutment and missing 2 teeth, see the large area missing, this is compromised.
So we should use the form.
Preferably implants or removable partial denture. Can we do a bridge on this? Yes, I can. The quick answer is yes. Can I do a bridge? I can do that. I can do it, but I'll tell the patient it's guarded prognosis. He has a short root. See how short the root is. So it's guarded prognosis, something temporary. We could do a metal post and raise the margin of the bridge over to be cleansable, but the metal will be the margin because we don't have enough dentine left.
Yes.
We could do a post, fiber post, but if there would be a failure, it will be in the interior abutment usually.
Yes.
Okay, so guarded prognosis, I could do a bridge for 2, 3 years, 5 years, but not more. Okay, if the patient prefers that, they don't have money to do an implant.
As a temporary solution.
As a temporary solution, I would do it, but I would not say it's a permanent restoration. I would say it's a temporary restoration. Okay, thank you.
دكتورة نفرجيكي اكس راي مريضتنا؟
ماشي.
عادي عبال ما تفتح.
سكر الفيديو.